What if Minnesota's biggest fraud wasn't committed by who you were taught to suspect? What if whistleblowers were punished, perpetrators protected, and the truth hid in plain sight? This is the What the Farce podcast.
You're a member of the House Fraud Prevention Committee. So in many ways, you really had a front row seat to the massive amount of fraud and the questionable politics at work with all of this here. You just recently courageously said on social media that you believe there is a racketeering enterprise in Minnesota, one that's been paying people off essentially for their loyalty to the DFL, the Democratic Party of Minnesota. And you're convinced of this.
Yes, I am personally convinced of it, which is a distinction from being able to prove it. I think the necessity to have all the T's crossed and all the I's dotted before raising credible suspicion that that is in fact what's going on is not necessary. We need to apply a certain degree of logic and reason and abide by our lying eyes, right? And recognize that there are certain patterns here that make it very clear that there's something insidious going on.
For years, fraud investigations in Minnesota have focused public attention on individual providers, small organizations, or people receiving public assistance. Meanwhile, decisions made inside state agencies by credentialed professionals with titles, degrees, and institutional authority have largely escaped public scrutiny. Advocates for whistleblowers say that imbalance shapes who is believed. They argue the public is repeatedly shown a narrow image of what crime and criminals look like, an image that often excludes government officials, administrators, and executives. As a result, when victims or whistleblowers report misconduct committed by people in power, their claims are frequently dismissed as implausible, retaliatory, or unreliable. Lawmakers and DHS policymakers neglect that the dynamic discourages reporting, isolates victims, and allows misconduct to persist behind closed doors, shielded by professional credentials, institutional affiliations, and the presumption of good faith due to alleged perpetrators' employment relationships and/or contracts for service delivery with DHS. Within the DHS structure, disabled victims of fraud inside DHS programs are restricted to third-party reports created by DHS, which victims are systematically barred from seeing outside of court proceedings reported to a maltreatment, abuse, and neglect of a vulnerable adult MARAC hotline controlled by Department of Human Services. For reference fraud, inside Minnesota, Department of Human Services would most often appears as dissent from procedural regulation, falsified documents, omittance of economically impactful facts from DHS-related documentation with the intention of altering budget guidelines and payments, false and inflated reports of service delivery and unit consumption to support fake billing claims to secure DHS payment, retaliatory discriminations aimed at discrediting victims such as false allegations of mental incompetence, presented as though they were formal diagnosis received outside of DHS contracts, addiction, violence, failures, refusals, ignorance, and outright false allegations of criminality. One civic whistleblower even alleges the formal creation of a criminal record that's lasted 10 years where none exist, as a form of retaliatory discriminations for reporting fraud in DHS home-based community-based services, a Medicare health insurance waivered healthcare delivery option. Victims inside the program would be the first to know when fraud happens, and DHS MARAC hotline would be their first contact. So what happened? Why wasn't fraud in Minnesota trending before the institution of DOGE?
We also heard during the hearing today some Minnesotans that testified that they reached out to DHS telling them about problems and never got a call back and got any help. Called to testify before the House Fraud Prevention and State Agency Oversight Committee was Kane Pence.
And how many times did I call DHS? They didn't do a damn thing. Nothing until there was the news report.
A couple of weeks ago, we shared Pence's story when he alleged his state-paid care provider wasn't always helping him, and he was concerned with how much the state was being billed. Pence told the committee DHS called him after our story aired.
The next day, they happened to call me. I find that to be more than just a coincidence.
If one looks at every related agency in the state of Minnesota, whom disabled participants of Department of Human Services programs may come in contact with, they'll see that none of those agencies accept abuse reports, They all direct victims to contact DHS Mark phone hotline. Victims of fraud in the Minnesota Department of Human Services prepaid medical assistance program and Medicaid health insurance, and supporters of Republican House of Representatives member Walter Hudson's claim of racketeering within Minnesota's government, claim the hotline operates as a weapon to identify and disarm potential civic whistleblowers more than as a hotline for reporting maltreatment, abuse, and neglect. They further assert that, with all agencies statewide supporting this MARC process, fraud in the state of Minnesota was overwhelmingly and systematically impossible to report prior to the 2024 election of President Donald Trump and the appointment of Elon Musk, who created Doge and inspired the Minnesota GOP to create a whistleblower portal, which is a website link that states, "Expose the fraud in Minnesota government. Fill out the secured form below. We will not share your data. Any information provided here will be sent to the GOP members of the House Fraud Prevention and State Agency Oversight Policy Committee for review above and upload form." In under 1 year of the creation of this form, more than $1 billion worth of fraud in the form of non-delivery of medical treatment and basic necessities such as food for children and the disabled has been discovered in the state of Minnesota. Minnesota has maintained state-operated disability programs for 226 years prior to the Doge initiative, which took off in 2025. Where are the DHS participant victims of those programs? What have they experienced inside these programs or at the hands of them? What is the state of each one of their medical conditions, and where are they right now, today? Who knew? Who participated? And where's the transparency and justice for victims held by the Minnesota Department of Human Services disability programs in and outside of state-operated facilities, from locked hospitals to Housing Stabilization Services? Who are the offenders? Where are the bodies? And how does the United States of America plan to gain accountability on behalf of those victims, living and dead, attached to the story unfolding in the state of Minnesota? This has been Bearing Witness. Until the next episode, signing off.